Okay. Good afternoon. Teka, hindi pala ako naka-video. Okay, let me check who are on video. Okay, very good. What about the others? Maka-freeze lang. Wow, konting panahon na lang. Second year na kayo. Okay, very good. So, for those who are nursing students, we have community diagnosis. Pero the level of community diagnosis in the medical field is now we call the COPC. Pero para mas mabilis nyo mag-grasp yung project nyo, we'll discuss the community diagnosis. So, of course, when we say community, they have what they call this group of people. So, when we say community, like you is a community already. The community of RTR community, we belong to one community, right? So also, senior citizen or our group or transport group is also another community. So we will define community diagnosis and understand the need for community diagnosis and the steps. And then later is on the management of COPC or community diagnosis. So when we say community diagnosis, just like COPC, it is a process of knowing and or discovering the real condition of the community through the data. So meaning the COPC now is a product of your community diagnosis. So once you have the community diagnosis, you will now make a COPC. Okay. So in community diagnosis, just like the COP, we identify community needs and problems. Sayang walang opportunity for you to be at the community and see their problem, either the felt needs, the real needs, no? Later, I will discuss it during the planning and management. And you prioritize identified problems. Kahit saan ka mapunta, sobrang dami ng problema. Also in the context of community, that's why we do prioritization. So kahit na sa family, okay, magpa-prioritize kayo, eto lang muna yung papaaralin or eto lang muna yung gagastusin. So nagpa-prioritize kayo on the problems that you are facing. So may mga negotiables and non-negotiables. Okay. And then you do the situational analysis of priority problems to identify root, causes, and possible solution. Ganon din sa COPC. So whoever the team leader in your group, you do the, you have identified 3 priority problems in an area. Is it malnutrition? Is it healthy lifestyle-related diseases? Or even governance or lack of manpower is another problem, no? So why is it important to have community diagnosis? Number one is to know the strategies to be used in addressing the needs of the community. Marami sa mga, mag-election na naman next year, no? Natutugunan ba ang mga needs ng komunidad? Or from daang matuwid to malasakit, ha? Nagkaroon ba ng pagbabago? From daang matuwid, it's Pinoy, to malasakit, to sino ba sa malasakit? Si Bongo or si Duterte? And to know the root cause of the problems and give specific condition. What do we mean by this? Marami na pumupunta sa inyo. You will become clinician in the future. No? Palaging pupunta sa iyo acute respiratory infection. Okay, reseta ka, but you are not really solving the problem. No? So yung pala, kaya naman pala palaging inuubo tsaka sinisipon ay basically merong naninigarilyo doon sa family, no? Or kung hindi man naninigarilyo, gumagamit pa rin sila ng kalan na de usok or de kahoy, no? So meaning ibig sabihin nun, hindi talaga mawawala yung respiratory infection. Or if you identify intestinal parasitism, hindi mo ano kasi yung pala wala naman pala talagang uh, uh, ano to sanitary toilet na meron dun sa community na yun. For example, if if you choose Barangay 68 or Barangay 69, marami doon mga flying saucer pa din yung mga ang lawak-lawak ng CR nila, yung buong dagat ng Tacloban. No? Kaya minsan, pag bumado sa nakikita mo maraming floating, ha? Puro floating mine nagfo-float sa McDonald's and So sometimes if you just do the strategy on environmental health sanitation, meron ka na agad sagot sa other diseases. So may ripple effect yung mga public health problems. Okay. So as you identify community needs, you are going to secure all the new records and statistics from government agencies, international agencies, and NGOs working in the area. So, paano niyo yan magagawa will be the challenge, pero meron naman siguro kayong na-identify ng mga tao who are in that barangay. Kasi anyway, MGCQ naman tayo. You can also visit the site, observe, use your eyes, ears, and nose. No? Na-remember ko yung may batch na first na nagpunta sila sa community, naka-estileto. Barangay 69 sila, dumaan sila sa tulay. Di naipit yung kanyang estileto. So umano siya ng school na walang takong, no? You can conduct dialogues and use focus group discussion with leaders and different groups of people, especially those who will potentially be affected by the project or the COPC. Next is you do an assessment. This is an approach through which all sectors of the community can identify, be involved in the community diagnosis. So, the participatory community appraisal assessment is usually composed of a facilitator, a documenter, and a process observer. So the main points for assessment should include the degree of people's participation in the activity, the facilitator's attitude and handling of the tools, and the proper documentation of the output. So usually we give it to, for example, you have already identified the problem, no, in the community, the 3 common problems, and then you're going to score it. As you score it, there will always be you assess first. Why did you say it's a score of 10? Why did you say a score of 5? No, why do you think this should be the priority? No? So the many people you have involved in the assessment, the higher the degree of getting into the root of the problem. So, another is focus surveys. You formulate questionnaires along with the community to gather data on a priority problem. So, pwede nyo rin itong gawin. Pwede nyo rin siyang gawin instead of the assessment. So, very simple. You can have 4 questions, yes or no, then you can just gather it. Or pwede rin by text, no? So, sa FGD, the community people will answer questions asked by a facilitator kasi group nga discussion. So, for example, you would like to have a focus group discussion among barangay health workers. You want to have FGD separately among the barangay council or mismong group of patients that are affected by the problem that you have identified. So, in the FGT, it's ideal that you should have only 8 to 12 individuals. So, in problem prioritization, problems are categorized into 3 types, no? Health status. A health status problem if it's a morbidity and mortality associated with diseases. Dengue, COVID-19, TB. So, yun yung mga health status problems. Anything that has something to do with morbidity and mortality. Health resource problem naman, such lack of medicine, lack of vaccine, lack of manpower, no? basically yung human resource for health is a problem here, not only in the city but to the whole Philippines. Okay, pag sinabi mo namang health-related problem, dapat ito prevalence. Ito yung mga indirectly, no? For example, alcoholism, substance abuse, violence, and poor environmental sanitation. These are all health-related problems. Hindi siya direct na sakit, pero it can affect eventually the cause the illness. Kaya siya tinatawag na health-related. So, if you have chosen decrease the prevalence of substance abuse in that barangay through an intensive advocacy as your COPC, you can do that via online. Oh, yun binigyan ko na kayo ng example. So it's a health-related problem. Okay. So what are some of the criteria for prioritization, no? First is, anong type ba ito na problem? Is it health status? Is it health-related or health? Ano is a health resource? So usually, if it's a health status problem, it has a higher what? It's a greater weight, no? Greater weight in terms of the nature. Pag sinabi mo namang magnitude, how many people are affected, no? For example, if you would like to COVID-19, is it the magnitude really is pero kung titignan mo, mas greater pa yung magnitude ng problema ng TB over COVID-19. So in the magnitude you're going to address, the more people that are affected, the greater the weight. So pwede mong tignan among if your COVID-19 will focus on the senior citizen or those with comorbidity, mataas siya, no? And then severity is how serious the problem is in terms of case fatality rate, no, like rabies and all these things, or how many people can die and in this disease or health status, no? And then important is perception of the community. Does the community agree that the problems are serious? So yung iba, magtataka ka na lang, ba't ganun? Parang wala lang sa kanila, ang dami-dami nilang anak. 'Di ba? Parang okay lang kahit 10 yung anak nila. Minsan pumunta ako sa mga sa barangay, anong sagot nila? Ay, botante yan in the future. So alam natin pag botante in the future, ano 'yon? 500 kada house or 500 kada boto. Ha? Are you familiar with that? Sino ba yung naka-experience na dito na stop share ko muna. Sino ba yung naka-experience dito na dinudulong na lang sa bahay-bahay? O ilan kayo sa bahay? Malapit na yan, sa next year na yan, 2022. Ha? Sino yung naka-experience na dinudulungan na lang kayo sa bahay? Dr. R, ha? Dr. Peñaranda, anong malaki ba?
Summer, yes, Doc.
Talaga? Saan sa summer?
Summer.
Lilipat ako doon. Ginapala, piko ang mga pera sa summer. But summer, no, despite of that, isa sa poorest of among the provinces. Dr. Angge, kamusta yung bakuna mo? Ha?
Ilang po, Doc.
Yung iba, nabakunahan na ba? Okay. So, anyway, yung pagbili ng boto is a governance issue. Health-related problem, like governance, is an issue. Bakit ito nagiging issue ang governance in terms of health problem? Gusto ko sumagot dito si Dr. Bargamento. Magiging future politician to.
Doc?
Tamo, hindi ka nga nakikinig.
Diri man, Doc. Correct politics, Doc. Correct. Diri ako also inclined with politics.
Malay mo. Paano nagiging part ang governance sa makakaapekto sa health problem ng isang community?
Well, for me, Doc, governance kasi is about leadership. So, if the leadership crumbles, Doc, so all the designated members will also crumble.
Be specific. Ano yung mga specific?
For example, Doc, implementation of health programs such as implementation of health programs such as deworming. So, how the leader will use its skills to designate the schedule, unavailable ng mga bakuna.
Grabe yung bakuna namin, na ano kami kasi lahat A1. Pagdating na sa verification, hindi naman sila A1, no? A1 sila, hindi A1, no? So something it is a system failure on the part of not the CTF but the management information system on verification, no? Dr. Insigne, you answered about policy making. Yes, it's very good. Why is it an issue? Why is it policy making?
Sample, Doc. Didihaaman, Doc. Bawal pumalipit mga bata pa. Sigarilyo nga, mga beer. Para derehera nagiging engulf ito yan ng mga activity.
Very good. Saang ano yan? Saang area yan?
37-A, Doc.
Ta?
37-A.
Saan ang 37
Palanog.
A? Palanog. Oh, very good. Awardan ko kaya yung barangay nyo, no? It's very
Doc. Pero good tanan, Doc. Pero may
yun kaya ang gawin yung COPC sa group nyo kasi it's group now, no? In the problem of kasi maganda siyang i-highlight to it's another way of doing the COPC. Challenge, okay? Others? Dr. Insigne, why don't you challenge your sa group nyo na yun ang gawin? Isa sa COPC project is a policy making parang ordinance on the ordinance to prevent the healthy lifestyle related diseases among young people. Isa yung yung policy mo doon is not allowing them to buy beer, yung mga cigarettes and actually nasa balaod diyan ng RA RA yung sa smoking, RA ano ba siya? RA ano mo RA yung sa sa smoking tobacco?
811.
May kulang pa. 81 hindi 8156 ba? No. Kulang 'yun. Basta may isa, it starts with a pero kulang. Okay? Meron pa? What are some yung mga what are some of the COPC you have think of already sa mga group leaders? Meron na ba kayo na-identify na problem sa group nyo?
Doc, group 6, may na kami potential.
Dr. Timban?
Doc, amon Doc, dede barangay 62A, Doc. Currently, tamon barangay naka-localized lockdown. Tungkol dito increasing cases. Gustong tanamon na namon focus is more on COVID. It's because na-observe ko gayapon na daw na naka-localized lockdown kami. Mga tao didi hamon, sige lagapit gawas, mga kabataan, ganyan papasagdan lahat mga kag-anak, sigit moruglay. So, definitely,
lalong tumataas. Parang hindi lockdown.
May talaga problem when it comes to ang pagdeal ng community. So, baga, dirisugad ka na era.
So, what are you going to do now? So, some of it, maganda rin yun, yung implementation of a granular lockdown at the barangay level. Barangay 62A. So, ang mo dyan is what you can do is probably capability building or training of your bida bastonero, no? mga ano magsasaway sa mga bata, mga ganyan.
Ang dadagulan Dok, pagkagawas.
Implementation of curfew, something, yun ang mga pwedeng gawin diyan so policy, tapos training, or organizing, you can organize by purok instead of the whole barangay kasi malaki yung 62A, no? Organizing
4,000 plus ata community ng
so you can organize, no, mga volunteers, no, or training of the volunteer surveillance officers on how to manage or prevent COVID-19. Very good. Yung iba pa? Sa ibang group? So maipoprove nyo dapat iba-back up nyo, Dr. Timbal, ng data why 62A yung sa COVID-19 na malaki siya, marami yung cases, yung deaths in terms. So magko-compare ka, pwede mo i-compare among all the Sagkahan district na barangay or barangay 62A versus the cases in Tacloban. So pwedeng ganun yun.
Pwede kami Dok makaroon dito ito City Health.
Yeah. Just the nurse. Tanungin mo lang yung nurse in charge.
Saan ka na Dok?
Hindi ko alam kung sino sa 62A Punta kasi sa Sagkahan district. Kung sino
Happy HN kami maaro or bisan nino dito na lang.
Dire, yung merong kada barangay may assign na nurse, HRH.
Okay. Sige. So ito naman comparison Dok, ang kanan districts na under Sagkahan na lang.
Yeah, meron sila yan. They have a summary of cases among people, among Sagkahan areas, among barangays in Sagkahan areas. So meron sila dyan, number of cases, tapos ilan dyan, kung ilan yung barangay yon, i-compare mo siya dun sa 62A.
Okay. And Dok, nearby la or go-upod pa na muna ng Apitong, kahit Apitong under Sagkahan district naman.
Lahat ng Sagkahan district.
Okay, sige.
So para pwede mong i-ranking mo sila, you can rank them, you can have pag-comparison what you are using, or pwede kang gumamit ng line graph from June 2020 up to the present, ilan na ang kaso ng 62A. And now mo on how to dig deeper on the health-related problem, bakit tumataas yung kaso doon.
Sige Dok. Noted. Thank you.
And other group, please, para makadiscuss tayo while I can give you
Hello, good afternoon po.
Yes, Dr. Noel.
Afternoon po, Doc. Actually, Doc, it's not the priority problem namin na na-identify, pero it's one of the problems identified kasi when we were already interviewing
What is it? Anong barangay?
It's in Ria. It's a barangay in Samar, in one of the municipalities in Samar. So, di ba, Doc, there's an article na I've read na parang increasing din yung incidence ng teenage pregnancy due to pandemic. Tapos, while I was interviewing the nurse for collateral, parang for additional information about the situations in barangay, one of kanya gihapon naging observation is medyo nag-increase kaging pakiana ko man, di ba, api mandok sa past health profile and teenage pregnancy because they are considered as high risk. Tapos usa ito na iya naging observation na nag-medyo nag-increase gud man sa last year until this year nga pandemic time. So naisip ko siya Doc as a challenge kasi before the pandemic, we have this program diba in DOH na Healthy Young Ones where we can reach these young adults, in-school young adults and out-school young adults. Pwede ito sa ma-reach, but because of the limitations, siniya na nga pandemic, so parang medyo may added na gihapon sin challenge considering that di rin man yata naka-access sa digital san digital means ba san pag-educate.
We're in summer ba? We're in summer.
In Durham, di rin good siya Doc as in high good kay parang 2 last year tapos 2 this year, pero compared to previous, medyo may add na lugod yan ng mga salbasan niya figures. So, pero di rin siya priority naman Doc na problem. Kaya naman priority was parang almost 50% of the households do not have their toilets, more on na-apply pa ang flying saucer na mga styles. Pero itong gulo nakakapagod. Opo, Dok. Kasi ano man sila, coastal, barangay man po sila, Dok. So ito na naman naging priority because it can be kuan sa mga waterborne diseases, mga ganun-ganun. Pero ito na naging alarming sa akin nga ito nga increasing incidents because if you are already going to think of the solutions, medyo may challenge na because of the limitations and aton maiging interventions in the community these days na pandemic pa po.
So, kayo lang, whatever, magsa-scoring naman kayo, kaya tuturuan ko paano mag-scoring.
Opo, ang ginawa na lang namin, Doc, we identified the problems, then we rank them based sa kung ano ko talaga ang pinaka-priority. Though, very good priority and to sa
lumabas?
pero it's a...
Priority.
Doc.
Anong lumabas?
Number 1 sa amin, Doc, ito niya, yung kasi 49 of the 93 households that have their own toilet. Tapos, ito na nga ni Doc, nga flying saucer pa. So, kasi
Pwede
coastal sira.
COD, Zero Open Defecation Project.
I interviewed the nurse assigned. They already started with the community-led total sanitation activity para nasa initial phase na sila ng proseso going to ZOD. Pero nasa initial pa lang sila, but it's good kasi may na-initiative from the barangay.
So ano pa yung maiko-complement nyo, di ba? Very good. Thank you. What about the others? Meron pang gusto mag-share? Other members of the group, other leaders, I mean. Okay, so let's continue. So, very, very important yung perception ng community because one of the issue here is the acceptability. Kaya maraming project na hindi nagpo-prosper kasi hindi naman nakikita ng community na problema 'yon. They need to agree that it is really a problem. So usually when there is a workshop that I'm doing. So wala naman tayong workshop if forgo na natin ito. So parang you are sa group nyo di-discuss nyo kung it depends on the nature, the magnitude, the severity, and the perception. So, according to magnitude and severity, a number simple way for the community to prioritize their problem is to rank them according to their magnitude and severity. So, multiply nyo, di ba? So, you rank it as okay, bakit mo yan i-rank as the number 1? And then the magnitude. So every problem will go to the 3 analysis, problem 3. Later mas nga ito yung sa baba, sa taas, for example, ano ba ang mag-ano kayo ng problem nyo about yung sa baba will be the cause. Yung sa taas is the effect, So, yung kagkakaroon ng malnutrition, ano yung cause nitong malnutrition? Yung sa taas naman, anong epekto nito? Eventually, they will die, lack of education, I don't know kung paano ko ito ipipresent. So, the problem 3 will help the community see that a problem always has a multifaceted roots and results. Emphasize that they need to address these facets during the planning. So, pupunta tayo later sa planning. And this can be the focus of their objectives during their planning. Okay. I don't know kung paano ba mag-chalk? Hindi ako marunong mag-chalk. So, for example, sige, let's focus on malnutrition. So, sa malnutrition, what are some of the kailangan kasi related yung meron kang 3, di ba? Paano ba yan? Sandali, tignan ko makakachok na ako. Whiteboard. Okay. Ay, ano ba yan? Ano ba to? Hindi ako marunong. Erase. Erase. Okay. Text. Or do you want another problem? Okay. So if yung kanina is malnutrition, mag-draw. Pag sa taas, 'di ba? Ganyan, arrow down, meron ka rito isang ano dito, effect. Tapos meron ka rin dito. Pagdating naman sa ano, N. Ay. Okay. Ayan. Okay, for example is, malnutrition is your problem. This is your problem, right? Malnutrition. Okay. So, what would be, give me one effect of malnutrition. Kung ikaw malnourished, anong isang effect sa'yo niyan? Dr. Margalio.
Stunted growth.
Oo, growth, stunted, saan ko ilalagay yun? For example, stunted growth. Okay. Pag stunted growth ka, ano ngayon ang mangyayari pa sa'yo? Anong effect nito? Ay, ano ba yan? Hindi ako marunong. Kunyari itong stunted growth, nandito yan siya sa ano. Ay. Paano ba ito mag-move? Sorry, hindi ako marunong. Select. Yun, okay. Paliitin ko siya. Ano ba ito paliitin? Okay. Anyway, stunted growth. Pag stunted yung growth mo, ano pang mangyayari sa'yo? Dr. Aliposa. Stunted growth, ha? Yun ba yung sagot mo, Dr. Margalio? Stunted yung growth? Physically. So, yes. If your growth is stunted, what will be the next effect on that?
Hindi lang ako sure, Doc, ha.
Yeah.
Doc, not able to parang move by his or her own. Like, parang hindi sila nakaka-walk properly or like.
Okay, so there can be some physical disability. Okay, that's good. So related pa rin siya, di ba? Okay, ngayon kung meron kang physical disability or malformation, pwede. Or disability na lang kasi hindi man natin for malformation. So again, mag-aano ka na naman doon, related to physical disability. And one of the kung may physical disability ka, pwede magkaroon ka ng anong pang-impact nun?
Depression.
Yes, so mental health you will be affected. So magkakaroon ka ng your self-esteem will now be affected. Okay, related pa rin siya doon. Pero ngayon, pwede mo ilagay dito yung mental health, prone to mental health problems. So either depression or ano. So kung prone ka sa mental health, pwede mo pa siya iakyat, pero magkakaroon ka rin ng mga illnesses, di ba? So kung prone ka sa mga mental health problems, pwede siyang connected dito. Okay. Pwede mo siya i-connect dito, prone ka sa mental health problem. Tingnan natin kung ano yung second na ano mo. Aside from stunted growth, ano pa yung effect ng malnutrition?
Depressed immune system.
Come again?
Depressed immune system, Doc.
Yes, very good. Sino sumagot no? Hindi ko nakita eh.
Timbal, Doc.
Okay. Decrease. Sorry. Ano ba yun? Depress or decrease immune system. Asan? Okay. Lagi, nakakainis naman ito. Anong tawag doon? Decrease. Ito pala. Draw pala. Mali. Hindi. Sige. Okay. Kapag mababa yung immune system mo, anong mangyayari sa'yo?
Prone to infection.
Yan. So, okay. So, papasok ka na naman. Maglalagay ka na naman dito ng another, draw ka na naman another table dyan. Okay. Prone to, ano yan? Sagot mo?
Prone to infection po daw.
Okay. Prone to infection. Okay. Pag prone ka to infection, pwede ka Okay. So, kung pwede ka akyat ka pa yan, another, yan, okay. Pwede kang illness or pwede ka ring magkaroon ng or ka mamatay. Death. Can be one, di ba? Yan. Death. Okay. Another pa, aside from stunted growth, decreased immune system, ano pa?
Easy fatigability.
Kasama na yun sa immune system. Another one on the mental. Mental absorption, mga ganyan. Anong mangyayari dyan?
Low IQ.
Yes, no? So, ilayo-layo natin to dito ng konti. Before ka mag-low IQ, ano muna yung
Mental retardation.
Hindi, result, ano yun, mental retardation? Mas mataas pang mental retardation.
Impaired cognitive function.
Yes, so mag-ano ka muna, yung cognitive function will be impaired. Okay. So dito, sino sumagot nun?
Me po, Doc.
So impaired cognitive function, ha? So kung paano ba palilitin ng, pwede bang palitin ng nito, mga text? Okay. So kung impaired yung cognitive function mo, akit ka dun sa taas, no? Pag umakyat yun sa taas, so ang mo affected yung iyong ability to absorptive capacity intellectually. Tapos pwedeng hindi ka syempre hindi ka makakaroon ng pag-aaral, kung hindi ka makakapag-aral eventually, yun lang yung matatapos mo, kung yun lang matatapos mo, no? Pwede talaga it will lead to hindi ka makaka-access to a better job, tapos yun lang, yung you will grow as like that. So parang ganun. Pagdating naman sa sa this defect, ano naman yung mga causes of malnutrition? Yung root. Ano yung mga root causes of malnutrition? Who would like to answer?
Food.
So food. Ito dito. Food availability. Okay. Or food security na lang. Okay. Ba't naman food security? Ba't naman kulang yung food and ano? Kung meron pang ano pa yung deeper level ito ng food security.
Low socioeconomic status po.
Okay. So, babag ka, low socioeconomic status. Ano ngayon kung because of poverty. Okay. So, pag binaligtad mo na naman ito, akyat mo ito yung arrow, babaliktad mo yung arrow dito. Okay. So pwede mo siyang baliktarin yung arrow dito eventually, no? Because low socioeconomic, may food insecurity resulting to malnutrition. Okay. So pag mo na, paakyat na siya. Okay? Another, aside from food security, ano pa yung mga
Parasitism.
root causes? Is parasitism an effect or a cause?
A cause, Doc.
Okay. So, bago ka muna mag-parasitism, ano munang nangyayari?
Hygiene.
Yeah, okay. So, poor hygiene. Okay. Okay. So, kung poor hygiene, dito ka na. Mas maano ka pa rito. Dito yung poor hygiene. Poor hygiene. Tapos ano mo? Akyat ka na naman, baliktarin mo na naman yung arrow mo kasi paakyat ka na hanggang makarating ka sa malnutrition. So mag-identify ka muna na pababa ng pababa pero related pa rin, di ba? So poor hygiene, anong ang sagot mo? There will be increased prevalence of intestinal parasitism. Nakuha nyo? Hindi lang kayo basta gagawa ng 3. Increased prevalence of parasitism. Paano ba ibababa yung liliitan yung ano yan? Anyway, parang ganyan lang siya. And then, habang nag-a-analyze pa ko, yan. So, ito, pwede na itong burahin. So, dapat yung ano mo dito, deeper pa. Di ba? Sino ang mas deeper? Low socioeconomic status is, ay, sorry. Okay. Oh, so yung low socioeconomic status is deeper, no? Lower than, no? Then magkakaroon, kung low socioeconomic, magkakaroon ng food insecurity. Hindi pala food security, food insecurity, ha? Change ito, hindi pala food, hindi food security, kundi food insecurity. Okay, tapos dito is one more sa sa malnutrition.
Chronic illnesses, Doc.
Bakit nagkaroon ng chronic illnesses?
Like
Another sa practices, no? Poor
Public health.
no. Ito ba na practices ba? Yung pagpapakain, food preparation, mga gano'n, yung mga knowledge, So, para ngayon, kung mapili nyo yon, yung knowledge, poor knowledge on nutrition, di ba? Tapos ganun palagi poor knowledge on nutrition or lack of knowledge, no? On proper food preparation, something like that. Dahil doon kasi nga, then malnutrition. So, pag mo ngayon, pipili ka na ngayon. So, napili mo ngayon is the root cause now is ito. Kasi, ang poor hygiene, ang intestinal parasitism, pwede mong ma-resolve or not at your end? Yes or no?
Yes.
Pwede?
Pwede po.
Yeah. So, ngayon, pipiliin mo to. This is now your, okay. Your root cause now is intestinal parasitism causing the malnutrition, and then poor hygiene. So pag ano mo na yan na yung na ano mo sa ano yun, sa area na yon. Yan ang pinili mo. So gagawa ka na ngayon ng plan on how to improve the hygiene practices, no? Hygiene practices in that particular barangay to resolve the malnutrition. So ang mangyayari naman ngayon is the objective 3. Okay. You don't want this to happen, so you are going to hold on to the root cause. If, for example, you have chosen this one, no? If you have chosen this one, yung kanina hindi ko lang nasulatan. Ito yung knowledge, no? For a lack of knowledge on food preparation and ano. So ganun ang gagawin niyo. Pagbigay niyo na ng mga activities niyo, will be training on food preparation or kaya paano magtanim ng mga masusustansya, kamatis, mga ganyan ba? Or develop a booklet on tamang pagkain or para sa mabuting kalusugan, something like that. Does this make sense?
Yes,
Hello? Okay, so you will try to digest, no? Doon sa mga problem na scrutinize nyo. Okay. Okay, poor concentration. So lahat ngayon yun, ma-identify nyo na as the root cause. Okay. So, ayan. Root causes, chronic overall shortage of food leading to protein deficiency, malnutrition. Sample. So possible solution, you can establish a new income generating activities, new forms of vegetable garden, and livestock. Intended outcome of that is you increase the supply of food containing appropriate nutrients. So you will no longer have food insecurity, but food security. One cause is cultural practices, allowing boys to have more food than girls. Diba? Merong mga ganyan, no? Culturally, resulting in malnutrition in girls. So, possible solution is you can have a training on gender awareness and health promotion. The intended outcome is you want to change the attitudes toward allocation of food in the family. Ito, mas maganda if you can make a community spot map, ha? So, either kung masyadong malaki yung area, if it's, for example, you can have the purok, no? So, and of course, you have to become familiar with the elements of the community spot map and you will make a sample. Ano? So, sa COPC nyo, kailangan meron kayong spot map, ha? Of the barangay. Okay? So, the spot map is a picture of the community. So, makikita mo dyan, nasan ang simbahan, nasan ang what you call this, nasaan yung eskwelahan, nasan yung pinakamalapit na health center, no? So, it's a kind of map, kaya nga siya tinawag na spot map, and shows the different and various situations in the community. So, dun sa spot map mo, kung nakita mo yung malnutrition, meron kang markings dun. Nasaan yung mga bahay na may malnourished? Okay? So, of course, the spot map has to have the title, the name of the community, town and municipality or city. There must be legend, indicates the meaning of the acronyms and colors used in the spot map. And then boundaries and landmarks. And different facilities available in the community. So kung nasa yung pinakamalapit na tubig, eskwelahan, population dapat nandun, and total number of household in the community. With the 4,062A, ilang number of household. And other relevant information according to the needs of the community. So maraming uses yung spot map, no? It gives information regarding the actual situation of the community, available facilities, water sources, type of houses, and also a tool to help identify the location of high risk or vulnerable groups in the community, such as pregnant women, for those sa kung ano yung ano mo sa women, postnatal mothers, newborn babies, handicapped individuals, elderly, etc. Okay. It can also be used as a guide to help plan for relevant health and development projects in the community. So magagamit namin yung spot map nyo, hindi lang for PCM1, pero babalikan namin siya for other sources. Okay? So yung workshop na yan, babalikan nyo yung kung anong community kayo, gagawa kayo ng spot map. Kaya yung time na matitira, although wag muna kayo, mag-groupings kayo, and hopefully tignan nyo kung ano yung magagawa nyo dun sa spot map. Okay? So we will use the remaining time on how to use the spot map. If you're, what do you want, Dr. Abilicano? Babalikan ko kayo or ano?
For the lecture po.
Hindi, for the presentation or dire-diretso na sa COPC yung spot map. Kasi yung remaining time for today is gagamitin for spot mapping.
Okay po.
Sige. Tapusin ko lang yung isang topic on the planning and management. So, I would like to end this lecture with mabilis lang isa. Caring without science is well-intentioned kindness but not medicine. On the other hand, science without caring empties medicine of healing and negates the great potential of an ancient profession. The two complement and are essential to the art of doctoring. So, caring and science. Caring with science, science with caring. Okay.
Hello po, Doc.
Yeah.
Doc, may dala po sana ako sana among group i-ask.
Sige, sure.
Ma-ask po kami sana hin data from City Health.
Anong
Tapos
barangay?
naghimo po Ancandocsen niya po. Palanog 7.
37A?
Yes po, Ancandocsen niya po, barangay. Ma-ask po sana kami hin data from City Health and naghimo po kami hin letter.
Under the DIT district yun.
Kung pwede po sana, Doc, maka-ask kaming signature, if okay lang po, or...
Yeah. Napasa nyo na?
Di pa po, Doc. Ma-ask pa po sana kami kung pwede kami maka-ask ka iyon signature, kay bangin po.
That's why you're asking my e-signature.
Yes po.
Yes.
Okay. I will send later.
Thank you, Doc.
Sige. May question pa?
Ma'am, are we gonna meet next week pa po?
Hindi na. Tatapusin nyo to. This will be the last lecture pero pwede tayong mag-meet para ipakita per groupings or what? What do you think?
Okay, pwede po, Doc, for na lang, per group na lang.
Or consultation, oo. Ha?
Yes po.
Or consultation.
Okay po. Thank you.
So very important yung community organizing and management, no? So part ng SOPC nyo, talaga dapat meron talagang management diyan. So we need to know the principles and function of management, ano yung community participatory approach and conceptualization of a project or yung COPC na tinatawag. So we know that management is a technique by which purposes and objectives of a particular human group are determined, clarified, and addressed. So meaning with the COPC, your purpose now is how you are going to produce a community-oriented public health project that would benefit not just to pass the PCM, but as well as makita talaga kung paano magagamit ito ng community. So it is also a process with both interpersonal and technical aspects through which the objectives of the organization are accomplished by utilizing human and physical resources and technology. So remember, PI, no? PI. The function of management is planning, implementation, and evaluation or control. Hindi ibig sabihin na control, you will control, but there are some internal and external control. So in planning, you decide what in advance, what is to be done. So you need to have an objective. You end towards which activities are aimed. So meaning, magkaka-related even your objectives to the activities and the strategies that you're going to use. So when you say strategies, these are methods of implementation. One example of strategies are networking is a strategy, organizing is a strategy, training is a strategy, but it's not basically the activities, no? So policies are general statements that guide or channel thinking or action in decision making. So procedures are the customary handling of activities. So for example, one of your strategy is training. What will be the procedure is you are going to have a blended training among the healthcare workers. Programs are the complex of objectives, policies, procedures, strategy, tasks, schedule, resources, and other elements required to carry out a given course of action. Pero syempre, kailangan yung COPC nyo may budget or may plan. Okay. So, as you look at the whole situation, you have to the pre-entry and the entry piece. Anong gagawin nyo? Mag-ano kayo ng data, gagawa kayo ng questionnaires for the focus group discussion. Then you recognize the important problems, set objectives, and review obstacles and limitations and integration. So gumagawa kayo ng COPC, nagmamanage din kayo. How you are going to manage your COPC? By planning. No? Okay. In the pre-entry phase, no, you have what are some of the criteria and guidelines for area selection. So, tinignan nyo, bakit 37A yung napili nyo? No? Kasi ito ba yung may access or ano? So, titignan nyo, bakit 37A? And then, adapt method. So, i-explain nyo yun sa pre-entry nyo dun sa COPC. Adapt method suitable to the people's condition by gathering information prior to entry. Okay? And then, letter C is identifying persons who can help. So, in the entry phase, in the community assessment, you identify needs, katulad sinabi natin kanina, you clarify problems and identify resources resulting to your community diagnosis. Okay? So there are some techniques na mention na natin ito, yung epidemiologic data, yung FHSIS, environmental indices, community forum, key informant interview, pwede kayo mag-text lang, opinion surveys, historical perspective, pwede kayong gumamit, or socio-medical health indicators. Second step is recognize important problems. So problems, sa COPC, ito, ginawa na nito sa community diagnosis, magnitude, severity, pero on a broader scope, sa iba, in-analyze magnitude, social values, national policies, and feasibility. So, dun sa resources, kaya nyo bang gawin yun? Okay? So, because you have the problem, what is the desired change? Okay? So, pag nakita nila doon, ano nga yung sa 37A? Teenage pregnancy ba? Ano sa 37A? Ano yung problem is 37A? Nakita nyo?
Teenage pregnancy, Doc. Masagihap, Doc. May kami case in 14 years old pala, Doc, yan, na pregnant.
Yan. So, ano mo, your desired change is to ensure to decrease the incidence of teenage pregnancy. So, specific, measurable, attainable, relevant, and time-bound. So, yun yung mga, you have to set the objectives. Okay, fourth steps is review obstacles and limitations. So, limitations, for example, ang laki ng barangay nyo, you want to make it, to purok na lang muna. And then, fifth step is integration. Yung integration is a process of establishing rapport. Pag ipapresent yun na sa community, then you're going to make you are going to integrate it or kumbaga makasama sa program ng City Health. Okay? We can never tell one of your COPC, we can adapt it. No? So implementation, okay, titignan mo na yun, yung organization, staffing, directing, and coordinating. So doon sa COPC nyo ilalagay nyo, for example, you have chosen itong advocacy na to, sino yung inyong health educator, HEPO nyo, sino yung mga iba-ibang role na gagawin nito sa grupo nyo. Okay. And then last is the control or evaluation. So you evaluate the activities ang difference dito, you do the monitoring on a project, but you evaluate at the end of the project. So, ang monitoring is continuous, ang evaluation ay at the end, no? So, pwedeng mid or end, pero ano siya, you measure the performance. Both, sa monitoring, mino-monitor nyo lang, pero wala pang performance na ini-evaluate, no? And then, you can also review deviation. Napansin nyo pala, kaya pala na marami yung teenage pregnancy, nakita nyo na wala namang ano, with the kind of, lockdown or possible yung modular, no? So, nakatutok na lang lagi pa sa sa computer. And then help assure accomplishment of plans. So, in the community participatory approach, just like I mentioned kanina, everyone who has a stake in the intervention has a voice where everyone's perspective is considered. Kaya kasama yung yung pagkita ng community na nakikita nila na problema talaga yung teenage pregnancy sa 37A. No? Pagdating naman sa 62A, ang kanila namang is the hindi makusog yung pag-implement ng mga health protocols, no? So, however, sa kailangan dun sa plano niyo, isasama niyo yung community. So, everyone gets to participate in the planning process and has some role in decision making. Okay. So, ano yung ibang level ng participatory? Information, tell the people what is planned, consultation, kung kailangan, you offer options and listen to the feedback of the barangay council, or you decide together, you act together, and then support independent community initiatives. So, in the conceptualization of COPC, there are a series of activities that are designed to achieve a result that is beneficial to a group of people. It must be well planned or organized. No? Introduction, tell about what the project is all about and its significance. The objective must be agreed upon by the proponent and the community leaders. No? There must be review of literature by describing the background and context of the project, and then the methodology, how you carry out the project. For example, empowering the caregivers of geriatric patients sa ABRNC, no? So, isa sa mga problema is increasing number of elderly patients, lack of caregivers for the elderly, the absence of caregiver training for the elderly. So, yung nakita nila kasi because of the technology, mas marami na ngayong mga elderly, for example. We have about 24,464 senior citizens sa siyudad ng Tacloban. So, your objective is to empower caregivers of elderly toward health through appropriate use of resources, facilities, health practices and belief lifestyle practices to train caregivers. Sandali . Okay. So, in the review of literature, ipapadala ko na lang to. So, the common complaints expressed by a family caring for patients at home become objections to continuing to function in the caregiving role. So, ito na ano niya, in Robinson's 1983, one of the most frequent complaints is interrupted sleep. So, the physician should anticipate some of this difficulty before they occur. So in chronic home care, the sense of responsibility and duty may replace caring and loving. So this caregiver relationship may be prevented by effective training, no? Or ite-train mo talaga yung mga caregivers. Okay. So strategy, community visit, education and training, resources, volunteers in the community, relatives of elderly patients. Training will take place in the barangay hall every Saturday for 10 consecutive weeks. Evaluation is written exam or post-test, pre-test, and post-test. Return demonstration to assess procedural skills, paano mag-CPR, or and then log diary to assess daily activities with the elderly. Okay, for example, you have a budget of 20,000. Uy, okay. Ano yun? Ano ba ako babalik? Nakikita niyo ako. Paano ako babalik? Stop share pa lang. Lokaret. Okay. So, I will send the slides para ano. Any questions so far? May namatay na naman.
Good afternoon po, Doc. I have a question. Regarding po sa program planning, since a program is implemented for like a long period of time, is it okay if we don't put how we evaluated it, since it will take time?
You will still put how you are going to evaluate.
How we're going to evaluate it, Doc, not Doc on the result itself or ano.
Kailangan mo pa rin evaluation kasi kahit hindi maggagawa ka lang ng evaluation tool on how to evaluate.
Oh, sige po, Doc. Thank you.
Ma'am G, question po.
Yes po.
Sorry, don't know where to start. So yung ginawa po kasi Ma'am G nung group namin is, since we're not from the same place, magkakalayo kami, we identified one barangay na maka-access kamihan health data. So now, Doc, we just got some data, tas we're trying to process them. So we haven't really identified the main problems, but we're looking at some possible na po. Tapos yung gagawin namin, Doc, is until, so full na po siya, Doc. So from introduction until planning, tapos
hindi, after ipapasa siya after finals na.
Apo.
Pero kailangan yung nag-gather na kamo, pero kasama pa rin sa yung first part, pwede niyo nang i-submit para meron naman ako i-as sa finals.
Okay po. Tapos, Ma'am G, so for this po, since 3 different na problems yung gagawin, so we would have 3 different problem trees.
Isa lang. From the 3 problems, you will choose your priority. Isa lang.
Just one. Okay.
Yeah, that's one. You will only make the program up to the budget of only one problem.
One problem. Okay po. Thank you, Doc.
So may problem 3, may objective 3.
Hello po, Mama G.
Yes po.
Question po. For the ones who want to submit for their initial work, how will they submit it po? Email lang.
Pero kailangan may title ha. Doon sa subject pala, kailangan may subject para mabasa. Kasi I received sobrang daming emails ko nare-receive. Paki-notify ako na nag-send ka mo ng email.
I will be the one to send it to you, Mama G, or per leader na lang po?
Pwede na yung group na.
Okay po. Thank you.
Any other question? May namatay na naman soon. Any other question? So I want you to, ako lang ang magli-leave para you can discuss by groupings on what to do next. Okay? So maximize your time. Any other question?
Good afternoon po.
Yes.
Ano po, Doc, for the preliminary na isasabit namin, up to community diagnosis lang po kami, Doc?
Hindi. Maggagawa kayo ng yung last di ba? May problem. Pag identify nyo na your diagnosis, meron ka ng problema, gagawa kayo ng intervention. Sample, for example, ang nakita nyo yung problem. Kanina ba in-example ko? Yung sa 37A, teenage pregnancy, isa sa pwede nyo intervention. You can have at least 2, 3 or intervention, di ba? Pwede yung doon is to make anong tawag doon, edutainment among sa schools na ipapalabas about it on how to the ill effects of teenage pregnancy. So yun yung project nyo. Yun na yung isasolusyon nyo, yun na yung gagawa nyo ng program, yun na ang gagawa nyo ng budget, yun na rin yung gagawa nyo evaluation. Ay! Hello?
Hello, good afternoon.
Apo,
Interview mo ngayon 4:30 regarding lang sa COVID situation natin dito sa Tacloban.
4:30? Okay, sige.
4:30 po?
Sige. Okay.
Sige. Thank you daw. Tawag kami ulit.
You're welcome.
Sige po.
Okay, may pa? May question pa?
Mama G, for the spot map po.
Yeah.
Are we gonna meet po for like Wednesday, only 6 groups, and then Friday, the other 6 groups po? Or all groups in one meeting?
Pero pwede ako ng hindi pwede 6. Pwede ako ng pa, bayan 5 o'clock pa, mga 6 kasi. Teka, interview ko pala ng Kailan sa Wednesday?
Okay. Yes,
Anong araw yung fiesta yun, di ba?
Ay, yes, Doc.
Holiday. It's a holiday.
What day are you available po, Doc?
Na lang tayo ng Saturday para di ba?
Okay po. Pwede po.
Meron na naman akong interview sa radyo. Naririnig niyo ako? Hindi ako naririnig sa radyo at sa TV.
I can hear you, Doc.
Sino yung nagsagot? Talaga?
Delikado po.
Ano naman? Tama na mga sagot ko.
Nakikinig po kasi yung mother ko. So, nakikinig.
Alam mo, ang nakakaano talaga, tigas ng ulo ng mga tao. And attitude talaga is really a very, very big factor in public health. And anything, anywhere, sa lahat, attitude. Ano na? Sige, okay, thank you. Bye-bye, Tutlikay.
Thank you po.
Love you.
See you.
I will just leave the meeting, ha? Kayo yung bahala mag-ano.
Okay po.
Thank you, Doc.
Thank you, Doc.
Thank you, Doc.
Thank you, Doc.
Recording stopped.